Hello, everybody. Good afternoon. Really excited to be back with you today. And we're going to be talking with Dr. Chris Bailey in just a couple minutes about whether or not it's safe to travel during COVID-19. So really excited to have him here on the show. Before we get started, as always, my name is Lori Kelly. I work in philanthropy at Providence, and we always have this disclaimer that this video is for informational purposes only, and it's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always please seek the advice of your physician or other qualified health professional with any questions you may have regarding a medical condition. So with that, Chris, welcome. It's great to have you on the show today. Yeah.
Thank you, Lori.
So you are an infectious disease specialist, and you are based down in our Orange County area at Mission Hospital in St. Joseph. Is that right?
That's correct, yes.
Yeah. And tell us a little bit about your background and tell us about infectious disease and what you're working on right now, and even how you got into that field.
Sure. Well, infectious disease was always very appealing to me throughout my training. It was an area that always seemed to be having a mystery to solve. It involved all parts of the body, all systems, so I wouldn't be pigeonholed into just one small area. And during my training in the early and mid or late mid 70s, later 70s, early 80s, there seemed to be a new disease coming around about every year with Lyme disease, toxic shock syndrome, obviously AIDS. So it seemed like an area that would be kept fairly fresh and challenging for an extended period of time. So that's how I gravitated into it.
Yeah, and you're certainly not bored now, right?
No, not now. So this is not. It's a different name, but it's a sort of a familiar scenario in terms of pandemics. Even though they've been relatively infrequent, it's something that we discuss and plan for, year by year, and have for decades. So that's what we're unrolling and have during this outbreak, but obviously we're still learning new things and refining whatever the original plan had been. And
right.
That's been obviously keeping us all busy.
And at Providence, we're over a 7-state area. I'm up in the Northwest. You're down in Southern California. Yeah. What's going on down in Southern Cal right now? What's the temperature like?
We seem to be getting over our surge. As you point out, it's a broad geographic area, and as people have seen just by watching the news, it seems to hit certain areas at certain times. Providence in the greater Seattle area actually had the first documented case in the U.S., and that area had their surge early on. Well, we here in Orange County and even LA County were relatively slow. Then the greater Seattle Northwest area in general began to improve, and Southern California heated up. And our peak, we hope will, in retrospect, still be able to call it our peak, seems to have happened a week or two ago. We're now trending downward. Hopefully that can continue. So that's just been what we've observed nationwide. It's not surprising. A virus enters a community where there hasn't been much activity. It finds a lot of susceptible individuals and can really get quite a foothold. And that's why we are certainly happy to have all the emphasis on social distancing and masking, because that can decrease the spread. And it seems to have been what we've observed here.
Yeah. And today we're going to talk about our topic, which is about traveling. But, I've just been curious why it took so long to get from Seattle to California for the peaks. Is that because of travel, or people starting to leave where they were coming from? What's your sense?
I think it's a variety of situations. I think when it first happened, people were understandably reluctant to travel far from home, and they sheltered in place, which is, I think, helpful in terms of containing the spread. I think there have been situations, at least here in Southern California, the recent surge happened as we were opening up the economy, and people were getting out more and gathering with people other than those that were in their immediate households. I think that allowed for spread among individuals. I don't think that can be prevented entirely. And
Mhm.
in some ways, you need spread within a community to get the herd immunity protection, again, absent a vaccine that's available. So when we read about the number of cases growing day by day, as long as that's not translating into a commensurate increase in the number of hospitalizations, most of those represent mild disease, people who are asymptomatic and being tested just because they think they've been exposed or they're
Right.
concerned, and that's good. That's increasing our pool of exposed individuals, people who will, in most cases, go on to develop natural immunity to some extent. That's yet to be defined, but if we look at
Right. A little
other viral
controversial.
infections, there is the expectation, at least, that there'll be some immunity associated with exposure or clinical disease.
Yeah. So let's talk about it's here. It is August. People are have been cooped up at home. They're ready to go on a trip somewhere. We were talking. I was asking right before the interview whether or not you've traveled and you're planning a trip. So how safe is it right now to get on an airplane?
Well, I think it's safer than it was 2 or 3 months ago for a variety of reasons. Obviously, in many portions of the country, we've reached our peak and are coming back down from it. So there's less, just statistically, a lesser chance that you'll encounter somebody with it in a given community outside of your own neighborhood. I think airlines and other public transportation entities have certainly put in place a large number of risk-lowering strategies, not filling planes, not filling every seat, maybe boarding from the back so people aren't brushing past each other, those that are already seated. I would be quite confident there's social distancing going on within the waiting areas and the ticketing counters and so forth. So I think all of that lowers your risk, but it does remind us that traveling is a fairly complex undertaking. It's not just you sitting in your seat on the plane or the bus or the train. It's everything that goes into getting there in the first place safely. And I think that circles back around to the best protection you can have is your social responsibility, your awareness of what potential risks there may be. And I think we're well aware from various messaging that's gone out from the CDC and state and local officials that social distancing, wearing a mask, hand hygiene, not touching your face, all of these are things you can do to minimize the risk. And if you're able to do that, if you take that responsibility, and if the carrier has provided the means for you to accomplish that with not putting somebody right in the seat next to you, providing hand hygiene supplies and so forth, then I think you should be able to travel safely.
And what about head coverings? I've seen some people that are actually, they've got hats on or they've got a, kind of a stocking over their head and also talking about not checking your bag, but actually keeping your bag with you. What do you think about those kinds of things?
Well, I think I can understand why those are considered. I think if you were especially vulnerable, immunocompromised, but had to travel, I think the first choice would be to delay travel if that was the situation. But I think that's maybe something to consider in those situations. But really, you just need to be aware that anything that's been out of your possession, you should assume is potentially contaminated and handle it accordingly. Wipe off the outside of your bag, or especially the handle, before you yourself open it. Once you handle your baggage, get into your rental car or your taxi cab, do hand hygiene. Either carry that with you, or I would imagine in many cases those will be available at the cab stand or at the rental office. So just frequent hand hygiene. I think people focus on the airborne or the droplet transmission by the use of masks and social distancing. I think contact, touching something that someone else has touched with a contaminated hand, and then touching your face or rubbing your eye without washing your hand first, I think that's equally, if not more likely, a means for you to contract COVID. So I think these are all things you can do, and with diligence, you can lower your risk to almost the same as staying at home.
Oh, that's great to hear. Yeah. So also, let's talk a little bit about driving by car. So if people are going to take long road trips, they're going to have to maybe stay in a hotel. They
Yes.
might have to, they're going to go to the restroom at the when they're gassing up and things like that. So tell us a little bit about, I mean, probably the same thing, but are there any other considerations that you'd have when you're kind of traveling by car?
Yeah, I think obviously that decreases or eliminates the risk of getting into an airplane cabin with other people and having others handle your baggage. It likely prolongs your travel time, which you need to take that into consideration. But yes, visiting the restroom anywhere at a truck stop, at a restaurant, you need to use your normal hand hygiene practices, but just make sure you're aware not only to wash your hands, but to wipe off the door handle or use a towel to use the door handle to get out. Remember, this gets into your body either by breathing in droplets or by touching something and then touching a mucous membrane. It's not going to get in through intact skin. So
Okay.
you don't have to, scrub down before you touch things. It's after you do that you need to be very diligent about washing before you touch your mucous membranes or another member of the family, because I think within families people are not going to be as likely to wash their hands after they've had contact with family members. So it comes down to the individual responsibility of family members to keep themselves germ free.
Yeah, yeah. And speaking of family members, so August is traditionally a family reunion time, and people are starting to get together a little bit more in the outdoors, camping maybe with friends or close friends or family. What are the things that we need to be looking out for when we do get together with people that we know and trust, but we're not in their bubble, right? So we're not sure
Right.
who they've been in contact with. So what are your recommendations like for, communal eating and things like that?
Yeah, as you point out, if they're not within your usual household, even no matter
Yeah.
how well you know them or how closely they're related to you, they're a stranger from a microbiologic perspective. So you need to be cautious. You don't want to have multiple people preparing the food. Those who are preparing the food need to be especially cautious to do good hand hygiene before they touch things and handle things. You might want to have those people who have prepared the food perhaps dole it out into individual portions rather than having a buffet line where multiple people are touching the utensils to put food on their plate. This virus is like any other. It's not especially hardy. It's not going to stand up to warm water or soap in terms of washing dishes, utensils, glasses. So you don't have to do anything beyond that in terms of eating supplies. And I think you might want to consider sort of grouping people around the dinner table by families. People who have lived together can stay close to each other. Others can be somewhat distant, but within earshot. It's obviously impractical to wear a mask throughout a meal, but after dinner, before dinner, when you're just sitting around, especially if you're not able to, or situation is such that you can't maintain the usual 6 foot social distance, then please be sure to wear a mask in those scenarios.
Yeah, good. Yeah, I think so many people are really wanting to get out and just go out to dinner, and so I always wonder too, what's your feeling on that for the servers in the restaurants and that kind of thing?
Well, from what I've observed, the few times I've gone out during this situation, the restaurants are very good about their employees, their servers are masked. They have separation between the tables to maintain social distancing. The expectation is that you'll wear your mask to and from the table, or if you get up to use the restroom, you'll put it back on while you're eating. You're fine not to use it, obviously. And I think that's generally gone well. Obviously, there have been instances where spread perhaps has occurred as a result of eating out, and restaurants are well aware of that. They really have a stake in maintaining low levels of transmission so that they can remain open. Obviously, we have suspicion when something happens, when someone comes down with something, but really there's no way to tell for sure if they got it at restaurant A or bar B, or just by visiting with relatives who weren't within their usual household. And obviously, I'm sure all the people listening are well aware there can be transmission before symptoms develop. So that's really why the masking comes in. You can't wait until someone's symptomatic to start distancing yourself from them. But as a corollary to that, if you are symptomatic, please take it on yourself to distance yourself from others. Don't go out even with a mask, because if you're symptomatic, especially if it turns out to be COVID, you don't want to rely just on the mask. That's a protection in the event or for the possibility of asymptomatic spread, but not to take the place of quarantining at home if you're actually symptomatic.
Right. We have a question from LinkedIn here, and the question is, what's the likelihood that infectious diseases, antibiotic-resistant microorganisms, and airborne respiratory viruses will be a recurring problem for the foreseeable future? They want to know, is this just the start?
Yeah, well, from a job security perspective, I hope that's the case. It has been in terms of multi-resistant bacteria, and that's driven by antibiotic use. That's where antibiotic stewardship tries to get at more judicious use of antibiotics to kill the bacteria, but not flood the patient with a drug beyond what is necessary, and perhaps trigger some more resistance to develop. As far as the respiratory viruses are concerned, COVID is the third coronavirus that's had epidemic or pandemic outbreak associated with it. The first was SARS back in the early 2000s, and then Middle East respiratory virus or respiratory syndrome, or MERS, about 8 or 10 years later. And now here we are with the COVID. Now, neither of those went truly pandemic. The SARS did spread to a number of countries, but not worldwide. The MERS was more limited. Neither of those established a recurring annual cycle like influenza has. So the hope is that may be the case with the SARS, the COVID-19, but we're not certain, obviously, as yet. Influenza.
Why didn't they spread more? Why didn't they go pandemic?
Well, that's a very good question. I think in part because the coronaviruses are not like influenza, where the virus itself changes little by little each year, and so can affect or infect people who may have been exposed to a prior year's version, let alone the existence of the vaccine. That I hope is going to be proven with the COVID, but we haven't seen that yet. You could make a case that because it's so widespread, there'll be too many little pockets that can potentially harbor it, spread locally for a period of time, and then it can burst out and be spread more widely, whereas the original SARS was limited geographically to just a relatively few areas. But it's hard to say. I think the existence of a vaccine will certainly be welcome. Whether this is one that burns out on its own and we're not relying on vaccine year after year into the future, just remains to be seen.
And I mean, you're not a fortune teller, but what's your prediction for when we would even know if that was the case? Another year?
I think another year, because I think it's still popping up here and there. As I said, Orange County, Southern California seems to be trending downwards. Other areas are trending upward, but I think probably within the next 3 to 6 months, hopefully we can see most areas around the world trending lower, and we will have gotten through, or at least into, the flu season and see what impact that may have. So I think really by next spring, we may know how well we've done with this outbreak, because I think we're still in the first outbreak. I don't know that we can say there's been a second wave or a third wave. I think it's just the first rolling outbreak. And we saw it, manifest in the the winter, early spring this time. I think if we get into early to mid-spring next time, we'll have a better gauge as to what may be in store for us. Hopefully we'll have a vaccine as an option, but I think it'll be at least that 3 to 6 months before we'll have any inkling as to whether this is going to be a chronic issue or a recurring problem like the flu, or comes and goes and isn't heard from again for 5 to 10 years like the previous coronavirus strain.
Right. Yeah, wouldn't that be wonderful? And I know we've got all our data analytics people, Dr. Ari Robichek and his team, just working on, looking at all the data across the system. So we've got, caring for millions and millions of patients and have all these medical offices as well as the hospital. So we're able to kind of detect some of the things that are happening a little bit earlier, which is very exciting. So if somebody is traveling,
that was helpful to us in Southern California.
Yeah.
We saw that the clinic visits were ramping up a week or two before we had our surge, our influx of inpatients, and the same thing with the downward trend that was also predicted by the model. So that's been very helpful for us.
Yeah, really helpful. Just amazing. All the team and how hard they're working to kind of try to predict the future, whether it's a month out or a couple of weeks out, but really helpful in how we're caring for our patients. And so we have another question here. If I have someone visiting, this is what the person's asking, who's been on a plane, what should I do when they arrive at my home? Should we social distance? What should the person that travels do to reduce spreading anything when they come to the home?
Yeah, I think this is sort of the other side of the travel coin. It's not just getting there, it's when you get there, what are you going to do? And I think both as a traveler or as the host, you need to be aware that this is somebody who's been exposed to a different environment and may well, be harboring something. So I think social distancing has to be maintained as you would hosting people from, down the street that don't usually inhabit your household. There is that risk, and that needs to be taken into consideration when you're planning, should I go or not? Just getting there isn't the finish line. You've still got to maintain these social distancing and risk mitigation strategies, and to the extent that may detract from your visit or make the visit not worthwhile, you need to make that determination before you get there and figure out that it's not going to be the same as it was last Thanksgiving or
exactly.
Visited. And the other issue is you need to be aware of what different states are doing. My trip I'm planning is within my state, so I don't really have that as a concern, but some states have put restrictions on travelers arriving from other states. Certainly if you're traveling to a foreign country, be aware of what may be in store for you when you arrive, as well as when you attempt to return back to the U.S. There may be quarantine requirements in place where all of your trip is going to be taken up in quarantine before you start your visit. So this is, I think, a crucial aspect of travel planning.
Yes, because even going to Hawaii, you have to quarantine for 14 days when you get there, correct? I think that's what I've heard.
I know that was the case at one point, but this is constantly changing. So take it into account when you plan and make sure you get updated information before you actually go.
And so let's say somebody came and visited you. For example, my sister-in-law just arrived yesterday from Florida. She's not staying with me, but I look forward to visiting with her. And so if she were to get a COVID test here, she still could test negative, but could have contracted it on the plane. Isn't that correct? Or how would that work? How would a COVID test?
The COVID test we have measures RNA. It doesn't test for viable virus, so it's not like a culture. So and it takes some days to manifest after you've been infected with the COVID. I think the peak incidence of getting a positive test is probably 5, 6, 7 days into the illness. And you can be asymptomatic for 14 days after you've come in contact with it. So just a single negative test doesn't say that person is not harboring the COVID. It does perhaps indicate that they may not be far enough in the illness to be contagious, but that's not necessarily the case on an individual basis. So if they test negative when they get here or just before they left, they could be contagious, but not yet symptomatic at some point during that visit, especially if it goes beyond, a 7 to 10 day period of time. So again, I think it all comes back to social distancing,
Yeah.
hand hygiene, make sure, surfaces that you may have touched in common are wiped down after, say, a meal preparation or sitting at the table together. It's not the easiest or the best visit, but unfortunately, I think that's what needs to be done to protect yourself and your family. And it goes both ways, as the visitor doesn't want to get doesn't want to be exposed to something.
Yeah, they want to. Right. And if you are visiting or you're traveling and you feel like, oh boy, I think I'm coming down with something, your doctor's not there, you're in a different city, what do you recommend someone do at that point?
Well, I think you should you should shelter in place in your room. First of all, curtail your excursions, contact local urgent care or hospital, via phone, and just see what is recommended. For the most part, the vast majority of patients who get infected with COVID have mild disease. They do not need to be in the hospital. They don't need to visit the ER unless they're having symptoms that might indicate a need for hospitalization, shortness of breath, fatigue, high fevers. Those, if you went to the ER, they would evaluate you and recommend that you shelter in place at home. Getting a COVID test, if it's an option, might be something to consider, because that will help you decide how to proceed. But I think the assumption, unless you can come up with another diagnosis, if you suffer from allergies, and in retrospect, after a few days, this was just a bout of your usual allergies.
Yeah.
I think the assumption that it's likely COVID should be the prime one.
Great. Well, so much great information. Dr. Chris Bailey, an infectious disease specialist from Providence down in Orange County. We really thank you today. Do you have any final words for the gang? I hope you have a great trip yourself.
Thank you. I intend to, and I'll just make the best of it within the parameters of COVID risk mitigation. I'm relying on the airline to provide some of that, but ultimate responsibility will rest with me.
Great. I think that's great for his final word today. And want to thank everybody for joining us. I hope you found this very informative. We love having these questions come to us. And so just want to thank you so much again, Dr. Bailey, for joining us today, and to everyone listening and sending us in your questions. If you are looking for medical advice, please visit us on the web at providence.org, and make sure to follow us on social media at Providence at Twitter, and under Providence Health System on Instagram, Facebook, and LinkedIn. Thanks, everybody. Have a fabulous day and stay safe. Wash those hands. Bye-bye.
Yes, thank you.
Okay, bye.